Hello, I'm Dr. Phyllis Bonham, and welcome to the Wound Treatment Associate Education Program. In this first lesson, I'm going to be discussing the anatomy and physiology of the skin and the soft tissue and implications for routine care. This first section is really going to provide a basis for the rest of our entire discussion about wound care, so it is important to understand the basic structure and function of the skin. So let's talk about the anatomy and physiology of healthy skin. I'd like to discuss some of the general characteristics of the skin. An interesting fact is that the skin is actually the body's largest organ, something that we often don't think about. We always think about the kidneys and the lung and the heart and the brain, of course, but the skin is the body's largest organ. It's critical to the health of the individual, of course. We need healthy skin for survival. Our intact skin, interestingly, is normally dry. It's supple, and it's slightly acidic. In other words, it has an acid pH. And it's going to be necessary as we discuss some of the other factors regarding wound care and healthy maintenance of the skin to appreciate the healthy pH of the skin. Because very often there are things that we do to alter the pH, such as using soaps, antibiotics, that would destroy the normal pH and it would become alkaline, and so that's not a healthy state. So it's important that we understand the acid pH of the skin. Other characteristics of the skin is that it has a brick and mortar type configuration. The cells basically form the bricks and the oils form the mortar. And hydration is extremely important to the healthy integrity of the skin, because if the skin gets too dry, then the cells are going to shrink, or if it gets too wet, they expand, and both of those conditions, too wet or too dry, make the skin at greater risk for damage. Another interesting and important characteristic of the skin is that it's only 2 millimeters thick. And this becomes important to understand how wounds heal, the damage that can occur to the skin, and a concept that might help to understand how thick the skin is that it is about as thick as a disposable contact lens. And so it's really quite thin. This is perhaps surprising. It's only composed of 2 layers, the epidermis and the dermis. And the reason we make a point of this, particularly later on in the course when we talk about staging of pressure ulcers, very often as nurses we tend to think that the skin is very thick and that a pressure injury would have to be very deep in order for it to be staged as a pressure ulcer. However, that's not actually accurate, remembering that the epidermis and the dermis together are only 2 millimeters thick. So let's talk about the epidermis and the dermis. We'll start with the epidermis. The epidermis is the outer layer of skin. It's composed of stratified squamous epithelial cells. It's about 20 layers thick. Now, these are normally dead cells that slough off throughout the time frame, basically throughout the day. The cells migrate up from the basal layer. The basal layer is very near the innermost layer, right next to the dermal layer, and this is where the epidermal cells are generated and developed through the process of mitosis. Another component of the epidermis that's important are the melanocytes. These are the cells that are necessary for the color of our skin, for the pigment. And an area that is particularly important that we'll discuss several different times in terms of skin injury are the rete pegs or the rete ridges. This is an area of transition between the epidermis and the dermis, where the epidermis has undulating portions that penetrate down into the dermis. And if I can point to that on this little diagram of the skin. When I'm referring to the rete pegs and the rete ridges, here's the epidermis of the outer dry cells. This section down here is all dermal tissue. And within the epidermis there are some undulating, sort of involuted, convoluted protrusions that are here. These are called the rete pegs, or rete ridges. And so this is epidermal tissue that's penetrating down into the dermal tissue. And that is extremely important as an interlocking function of the epidermis to the dermis. In other words, the epidermal tissue protrudes down into the dermis to lock it in place. Otherwise, the epidermis would just be sitting there like 2 plates, and if you pulled tape or something, you would just basically shear the epidermis off of the dermal tissue. So we'll talk more about the rete pegs or the epidermal-dermal junction in a couple of different fashions as we go through. go through the course, because the immaturity or a poorly developed area with the retape pegs puts the patient at increased risk for skin tears. And so we'll discuss that greater. The function of the epidermis is primarily for protection. Also, the epidermis contains the nerve endings, so it's a sensory organ, which is important. The component as far as functioning for healing that is necessary to understand about the epidermis is that the epidermis is able to regenerate itself. You may have heard the story about the salamander, that if you cut the salamander's tail off, it's able to regenerate it. Well, epidermal tissue functions in that same method. Epidermis can regenerate, regrow itself without any loss of function or any loss of appearance, so it looks the same. The next layer of skin is the dermis, or the dermal layer. That's the innermost layer. It provides the support and nourishment to the epidermis. It also provides the strength and the elasticity to the skin. Some of the key structures in the dermal layer are connective tissue that's comprised primarily of elastin and collagen. Also, the blood vessels, primary function place for the blood vessels, are within the dermal tissue. And then there are nerves in the dermis as well. Now, another feature that I'd like to point out when we think about the epidermis and the dermis, if we look at this area again here, we've got the outer dry area for the epidermis, then we have those retape pegs and ridges, and then this is our dermal tissue that's here. Now, normally when we look at our skin, we'll see that there are hair follicles and sweat follicles and appendages that are there. These hair and sweat follicle appendages, the base of those epidermal appendages actually reside down in the dermal tissue. They protrude out through the epidermis. Also, another feature of these epidermal appendages here, the hair and the sweat follicles and the sebaceous glands, is that they're actually lined with epidermal cells. So they provide, in a way, a repository or a bank of epithelial cells that can help heal wounds as long as they're intact. However, as we mentioned about the epidermis is able to regenerate and regrow itself if it's injured. The dermal tissue is not able to regenerate. So if dermal tissue is damaged, and if these hair and sweat follicles are completely destroyed or damaged, then the injury has to go through a repair process called scar formation, or the healing cascade. And we'll discuss the healing cascade a little bit more. Dorothy Doty, one of our other course instructors, is going to be discussing that in more depth for the healing cascade. So you'll hear more about that in just a little bit of the future lessons.